Does your vision ever look like this? No, you're not hallucinating. No, your eyes aren't haunted. You're just experiencing vitreal floaters, which are totally normal and totally annoying. So what are vitreal floaters? They're actually tiny little clumps of collagen fibers that are located in the vitreous humor, which is the jelly-like substance in the back of the eye. As light passes through our eye, it hits these small little opacities, casts a shadow on the retina, and voila, there's your floater. Now, these floaters can have a bunch of different shapes and sizes. They can be little dots, threads, or even cobwebs, and they could affect all different age groups. It's really common in highly nearsighted individuals or if you've had previous trauma or surgery. The main culprit is, of course, age. Very commonly in our 50s and 60s, the jelly will start to liquefy and shrink and form these tiny little clumps in the vitreous humor, a process called vitreal syneresis. Now, eventually that jelly will continue to liquefy and pull away from the retina, which is then termed a posterior vitreous detachment. Again, this is totally normal, but you may notice a few more floaters, even a flash of light when this occurs. So the million-dollar question, when do you need to worry about floaters? Now, the floaters themselves are completely harmless and a normal part of aging, just like gray hair. But sometimes they can represent a significant problem, and you should see your eye doctor immediately if you notice an increased number of floaters or persistent flashing of lights or loss of peripheral vision. So unless you experience any of those previous symptoms we just mentioned, floaters will improve with time as they settle further in the bottom chamber.